Ballad Health today reported 90 patients in their hospitals with confirmed cases of COVID-19. 23 of those patients are in intensive care. 17 of those patients are on ventilators. Well, in a press conference today, Ballad Health's Chief Operating Officer Eric Deaton said week to week, the number of hospitalized COVID-19 patients continues to rise.
It's been a concern. Well, Febin Casahoon now explains how Ballad is trying to reduce the number of inpatients in their facilities.
Over the last month, Ballad Health officials are continuing to see a steep incline in COVID-19 patients in their facilities. They're wanting to remind people that no one is exempt from getting COVID-19.
We are fighting this war on a daily basis.
Because of the demand for testing, the delay for results is growing.
They can sometimes take up to 2 weeks to get those results back. We do have in-house testing available to us, but we're limited in the number of in-house tests that we are able to perform. Many times we're saving those in-house tests for emergencies and for our surgical patients.
Ballad Health officials say they're now performing more than 800 tests each day. 32,000 total tests have been administered by Ballad across the region.
If you're thinking about needing to get a test, just think about what the reason is for needing the test. Really consider whether are you symptomatic or have you been in direct contact with someone who has COVID-19. Otherwise, there may not be a reason for you to get a test at this time.
Health officials are seeing positive rates increase from 1% to 2% to more than 7%.
We have seen formerly healthy, fairly young people succumb to having to fight for their lives on a ventilator. And others of many ages have succumbed to the disease. Even those who do survive the disease, if they end up being very, very sick, may have a long and arduous healthcare recovery.
The healthcare system says they now need more team members.
In addition to new graduates, if you're an experienced nurse in the region and you may have been furloughed or lost your position in another area because of the current crisis, we would love to talk to you as well about opportunities at Ballad Health.